Hi everyone, welcome back to my YouTube channel and today we are going to talk about palate anatomy. So let's start our topic with introduction. Palate is structure forming the roof of oral cavity and floor of nasal cavity. It separates the oral and nasal cavity, facilitating breathing and eating simultaneously. Palate plays a critical role in speech, swallowing, mastication, and taste. It is divided into two main parts that include hard palate, that is the bony anterior portion of palate, and soft palate, that is the muscular posterior portion of the palate. Division of palate is in the hard palate and soft palate. So first we will talk about hard palate, then we will talk about soft palate. Hard palate. It is located anterior at the anterior two-thirds of the palate. It is formed by a palatine process of maxilla and horizontal plates of palatine bone, as you can see in the diagram. It is covered by keratinized stratified squamous epithelium for protection during chewing. Its features include incisive fossa, that is depression behind the central incisor that contain nasopalatine nerve and vessels, greater palatine foramina that transmit greater palatine nerves and vessels. It has lesser palatine foramina that transmit lesser palatine nerves and vessels. And then it has palatine rugae that are transverse ridges for friction and grip. Talking about soft palate, it is located at the posterior one-third part of the palate. It is muscular mobile flap that is attached to the posterior part of hard palate. It ends in uvula. It is covered by non-keratinized stratified squamous epithelium. Its function is to elevate to close the nasopharynx during swallowing and speech. Muscles of soft palate. First is tensor veli palatini that tenses the soft palate. Second is levator veli palatini that elevates the soft palate. Third is palatoglossus that elevate posterior tongue and narrow oropharyngeal isthmus. Fourth is palatopharyngeus that elevate pharynx and larynx and it closes nasopharynx. Fifth muscle is musculus uvulae that shortens and lifts the uvula. Nerve supply of palate. It has sensory nerve supply. Sensory nerve supply to hard palate is by greater palatine nerve and nasopalatine nerve that are branches of maxillary division of trigeminal nerve. Sensory nerve supply to soft palate is by lesser palatine nerve that is also the branch of maxillary division of trigeminal nerve. Then there is motor nerve supply to the palate. All soft palate muscles except tensor veli palatini supplied by the pharyngeal plexus that are by the 10th cranial nerve, that is vagus nerve. And tensor veli palatini is supplied by mandibular nerve that is the branch of trigeminal nerve. Blood supply of palate. Arterial supply, it is supplied by greater and lesser palatine arteries, that is branches of maxillary artery, and also by ascending palatine artery, that is branch of facial artery. Its venous drainage is drain into pterygoid venous plexus, pharyngeal venous plexus, and facial vein. Lymphatic drainage of the palate. It drains deep into deep cervical lymph nodes, particularly into jugular-digastric lymph nodes. Relations of palate. Superiorly to palate there is nasal cavity and nasal septum. Inferiorly to palate there is oral cavity. Posteriorly to palate it is continuous with the pharyngeal ball and soft palate. Functions of palate. First is separation, as palate divides nasal and oral cavities, thus allowing simultaneous breathing and eating. Second function is speech, as palate helps articulate consonants by controlling airflow. Third function is swallowing, as soft palate elevates to close nasopharynx, thus preventing food entry into nasal cavity. Fourth function is mastication, as palate provides rigid surface for tongue compression during chewing. Fifth function is taste, as some taste buds are present in the soft palate. Clinical significance of palate. First is cleft palate, that are developmental defect due to failure of palatal shells to fuse. Second is vulvopharyngeal insufficiency, that is inability of soft palate to close nasopharynx, thus causing nasal speech. Third significance is palatal tumor, that is commonly benign, but knowledge of anatomy is vital for surgery. Fourth significance is infection, as palatine tonsillitis or abscess may involve palate. Fifth significance is uvular deviation, as it is seen in vagus nerve lesion. Conclusion of this lecture video. Palate is complex anatomical structure that plays a vital role in swallowing, breathing, speech, and taste. Its division into bony hard palate and muscular soft palate, along with its intricate intervention and blood supply, make it crucial in clinical practice, especially in dentistry, ENT, and speech therapy. And this was all about palate anatomy. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.